Good morning, everyone. I'm Mercy, final year BPT student from Saveetha College of Physiotherapy. Here I'm going to present a research topic which is effectiveness of Rocabado exercise versus Masseter muscle relaxation among subjects with temporomandibular joint dysfunction. This study was carried out under the guidance of Dr. Pratap Sugandhira Babu, Principal, Saveetha College of Physiotherapy. Here I'm going to discuss about introduction, review of literature, background of the study, need of the study, methodology, aims and objectives, discussion, result, and conclusion. Also, I'll share some insights about Masseter muscle relaxation and Rockabado's technique. At the end of this presentation, you all have a better understanding about TMJ joint dysfunction. Introduction. Temporomandibular joint dysfunction is also known as TMD. It is a disorder which mainly affects the temporomandibular joint area and the muscle which is around that joint, especially a masseter muscle. Masseter muscle is a main muscle which affects commonly in this type of conditions. Patient often experience pain while chewing, pain while opening and closing the mouth, limited range of motion, lockjaw, and pain which is radiating to ear, face, and neck. So for this, I've taken two intervention. One is Masseter muscle relaxation, and the other one is a Rocabado 6x6 exercise program. Masseter muscle relaxation can reduce tension of masseter muscle, which can be a cause of limited range of motion. Rocabado 6x6 exercise program found to decrease pain and improves function of the masseter muscle, restore joint mobility and restrictions. Review of literature. Several studies have supported this intervention. Young Suk Bay et al. 2013 showed masticatory muscle relaxation significantly reduces deviation in unilateral TMJ issues. Pionter Herbansky 2021 found that relaxation technique reduces tension in the masseter and temporal muscle. Nihas Suraj Mulla 2015 advocated Rockabado's technique for reducing pain and improving mobility. Sushma Bankar 2021 confirmed Rockabado's approach helps patients with mild to moderate dysfunction. These findings laid the foundation of a study. Background of the study. The masseter muscle is often the most affected in temporomandibular joint dysfunction, making masseter relaxation crucial. Rocabado 6x6 exercises, when combined with ultrasound therapy, have shown positive outcome in managing TMJ joint dysfunction. Hence, this study compares both intervention to assess their effectiveness on pain relief, range of motion, and jaw function. Need of the study. This study compares both intervention, which is masseter muscle relaxation, and Rocabado exercises to assess their effectiveness on pain relief, range of motion, and jaw function through an outcome measure, which is NPRS, ruler, and jaw function limitation scale. Aim of the study is to compare the effectiveness of Rocabado exercise and masseter muscle relaxation among subjects with temporomandibular joint dysfunction. Objectives of the study: to analyze the effects of Rockabado's exercise with ultrasound therapy. Secondly, to analyze the effect of masseter muscle relaxation with ultrasound therapy. And finally, to compare both interventions using three outcome measure. One is numerical pain rating scale to check a pain, and secondly, ruler to check a range of motion, and finally, jaw function limitation scale to check the jaw functions. Methodology. This is a comparative study conducted at Saveetha Dental College and Hospital. Sample size 30 subjects, 15 in each groups. Age ranges 20 to 40 years old. Inclusion criteria: mild to moderate pain over the TMJ joint, limited range of motion, muscle spasm over the masseter muscle, unilateral TMJ joint dysfunction. Exclusion criteria: dislocation, dental processes, surgeries, and bilateral TMD. Outcome measure: NPRS, numerical pain rating scale to assess the pain intensity, ruler to measure the range of motion, which is mouth opening, right and left deviation. Thirdly, jaw function limitation scale, 20th version, a validated scale that measures limitations in jaw function like chewing, talking, smiling, yawning, and so on. These are the pictures of NPRS, ruler, and jaw function limitation scale. Group A, Masseter group, treatment given duration 20 minutes. Firstly, ultrasound therapy, mode in continuous mode, frequency is 3 megahertz, intensity is 1 watt per centimeter square, and Masseter muscle relaxation for 5 minutes, and basic jaw exercises for 10 repetitions, which is side to side jaw movements, resisted mouth opening and closing, forward jaw movements. Group B, Rabagodo group, treatment given duration is 20 minutes. Firstly, ultrasound therapy, same as in the Masseter muscle group. Next, secondly, Rabagodo exercise, which need to be done 6 repetitions and 6 times a day. The exercises includes resting position of tongue, controlled TMJ rotation, rhythmic stabilization technique, stabilized head flexion, axial extension of neck, shoulder posture corrections. These are the exercises to restore the joint mobility and muscle length. Result, post-test values of two groups, which is Masseter group and the Rabagodos group. Firstly, NPRS. So in NPRS, Masseter group Masseter group value is 0.67 and the Rabagodo group value is 2.13. And in the secondly, and in the jaw function limitation scale, Masseter group value is 11.67 and for the Rabagodo group value is 54.67. And thirdly, the range of motion of the mouth, which is mouth opening. In mouth opening, Masseter group value is 45.67 and Rabagodo group value is 35.67. And secondly, right lateral deviation, in that Masseter group value is 10.47 and Rabagodo group value is 8.67. And last, finally, left lateral deviation, in this Masseter group value is 10.93 and Rabagodo group value is 1.18. Discussion. The study highlights Ravagodo's technique improves posture, joint mechanics, and muscle balance. Masseter relaxation provides more immediate relief for localized muscle tension and pain. Our research suggested that Masseter muscle relaxation is more effective in managing unilateral TMJ joint dysfunction, likely due to its direct impact on the main affected muscle. Key insights. While both methods works, the best approach may depend on the patient's symptoms. Localized pain responds better to relaxation, while postural and mobility issues may need Ravagodo's approach. Conclusion. Both techniques are effective for managing TMJ joint dysfunction like pain, range of motion, and jaw function, but in this study, the result concluded Masseter muscle relaxation showed greater clinical improvement in pain, jaw mobility, and jaw function. It is a simple, practical, and efficient intervention, especially for cases with unilateral pain and muscle spasm. References. These are some of the key references that supported our research methodology and interpretation. They cover clinical outcome for both Masseter muscle relaxation and Ravagodo's technique in temporomandibular joint dysfunction. Thank you.